You know that feeling. You want to understand something pretty complex, but wading through dense text just feels like too much work.
Yeah, absolutely.
Well, that's exactly why we're here. Today, we're doing a focused exploration, a deep dive into a specific neurodegenerative condition that affects Rottweilers.
Hmm.
It's concerning for owners, obviously, but neurologically, it's actually quite fascinating.
It is, and we've pulled together the key medical info on this disorder. Think of it as, well, a shortcut to getting the basics.
Right.
What it is, how you might see it showing up, the diagnostic process. Our mission here is really to pull out the essential details, the impact, how it's identified, and how it usually progresses, so you come away with a clear picture.
Okay, let's jump in. The condition is called leukoencephalomyelopathy. Bit of a mouthful.
It is.
But basically, it's a neurodegenerative thing hitting the white matter, like the wiring
Right.
in the brain and spinal cord of Rottweilers.
Exactly. And what's really key is how that damage shows up. It causes this slow, steady loss of coordination in their legs. We call that ataxia.
Ataxia. So they just get progressively clumsier.
Pretty much. Imagine them just having more and more trouble with basic movements. It's chronic, progressive.
And you mentioned the neck seems important, like the signs point there.
Yeah, the most obvious signs often relate to the cervical spinal cord, the neck area. But, and this is crucial, the damage isn't just there. It's actually pretty widespread.
Okay.
It also hits the brainstem, think vital functions, the cerebellum, which handles balance, and even deeper white matter in the brain itself.
So it's a whole system issue, really.
Definitely. And it's not just a local problem either. It's seen in Rottweilers all over the world. Plus, the evidence really points towards it being inherited. Autosomal recessive is the likely pattern.
Inherited. Okay, that brings up the question, which Rottweilers are we talking about? Any specific age or sex?
Good question. It seems to affect adult Rotties, male or female, doesn't seem to matter. But there is a typical age window for when symptoms first appear,
Oh, yeah. What's that?
usually between about 1.5 and 4 years old. That's a really important time frame for owners to be aware of.
1.5 to 4 years. Okay. So for someone with a Rottie in that age bracket, what should they be looking out for? What are the first signs?
Well, this is where it gets a bit tricky. The onset is usually really subtle, insidious even. And importantly, it doesn't seem to cause pain.
No pain. That would make it easy to miss initially.
Exactly. You might just think they're a bit clumsy or something. And even though the damage is widespread, like we said, those signs linked to the neck part of the spinal cord often show up most clearly at first.
Okay, let's get specific then. What kind of movement changes would an owner actually see?
The main thing is what vets call proprioceptive ataxia. It's like they lose their sense of where their limbs are in space.
Their body sense.
Yeah, exactly. So
Yeah.
you might see them delay bringing a leg forward that's protraction, especially the front legs. And when they do swing it forward, they might kind of overreach, lift it too high.
Like they're misjudging the step.
Precisely. And there's also usually some upper motor neuron weakness contributing to it all.
Interesting. You mentioned the front legs often seem worse than the back.
That's a pretty consistent finding, yes. Front legs generally more affected than the hind legs. You might also see a slight difference between the left and right sides, a mild asymmetry.
Okay.
But one really consistent sign you see in all 4 limbs is nail scuffing.
Ah, so you might actually hear it.
You might hear their nails dragging or just notice they're worn down because they aren't quite lifting their feet clear off the ground.
Makes sense with that lack of body sense.
Yeah.
What about when the vet does those reflex tests? Tapping knees and checking paws.
Right. During a neurological exam, they'll check proprioceptive positioning, like if you knuckle their paw over, how quickly do they fix it?
Yeah.
In these dogs, that correction is often delayed or maybe even absent. Same goes for hopping reflexes. Slow or absent in all limbs.
But the knee-jerk type reflexes.
Interestingly, those spinal reflexes can be normal or sometimes even exaggerated, hyperactive.
Okay, so we're getting a clearer picture of what the symptoms and the who adult Rotties, 1.5 to 4 years. Let's talk about the why. What's actually causing this? Any risk factors?
Well, like we touched on, the strongest suspicion is that autosomal recessive inheritance.
Okay.
And when you talk about genetic conditions in specific breeds, that often, points towards inbreeding potentially playing a role.
How so?
With a recessive condition, an offspring only gets it if both parents carry the faulty gene. If dogs within a breed are more closely related through breeding, there's just a higher chance of 2 carriers being paired up and passing on 2 copies of that gene.
Ah, okay. That makes sense. So that's a potential risk factor within the breed. Now, if an owner does suspect something's wrong, based on these signs, what happens next? How do vets figure this out for sure?
It's tough just based on the signs because they can overlap with other neurological problems, so you can't just rely on the clinical exam.
Right.
This is where imaging becomes really critical, specifically MRI magnetic resonance imaging.
MRI is the key tool.
Absolutely.
Yeah.
It lets vets actually see the characteristic damage inside the brain and spinal cord white matter.
And what do those images show? What are the giveaway signs on an MRI?
The classic findings are these bilateral, meaning both sides, symmetrical, well-defined oval spots. They show up brighter than the surrounding tissue on certain MRI sequences.
Bright spots.
Yeah, hyperintensities is the technical term, and they're found in specific tracts within the white matter, the dorsolateral funiculi of the cervical spinal cord.
Okay.
What's also quite distinctive is that these bright areas often form a continuous lesion stretching right from the base of the skull, the cervicomedullary junction down the neck, to about the level of the sixth neck bone, C6.
Wow, that's a very specific location and pattern. Does it show up anywhere else on the MRI? In the brain itself?
Yes, it does. You also typically see symmetrical bright spots, those hyperintensities, in specific brain areas too, like the pyramids and the ventral part of the crus cerebri.
Okay.
And another important point, from the sources, these lesions usually don't light up with contrast dye.
Ah, no contrast enhancement. Why is that significant?
It helps rule out other things, like inflammation or certain types of tumors, which do often enhance with contrast. So it's a helpful clue pointing towards this specific condition.
What about simpler diagnostics, like regular x-rays or testing the spinal fluid?
Generally, no. Standard x-rays of the neck usually look completely normal in these cases.
Okay.
And analyzing the cerebrospinal fluid, the CSF, that's typically normal too. So while those tests might be done to exclude other possibilities, they don't usually help confirm this diagnosis. MRI is really the gold standard here.
You mentioned other conditions can look similar. What kind of things need to be ruled out?
Yeah, that's the differential diagnosis list. It's important because clinically they can be tricky to tell apart, especially early on. Vets need to think about things that compress the spinal cord in the neck.
Like Wobbler syndrome.
Exactly, Wobbler syndrome, or things like cervical subarachnoid diverticular outpouchings or fibrotic stenosis, even spinal cord tumors. These can all cause gradual neurological signs.
Any others?
There's neuroaxonal dystrophy, though that often affects the cerebellum more obviously, and distal sensorimotor polyneuropathy. But that usually involves lower motor neuron signs, which aren't typical for leukoencephalomyelopathy.
What about things that cause more sudden problems or pain?
Well, they're still on the list to consider, even if less likely. Things like discospondylitis, that's an infection of the discs and vertebrae,
Right.
or spinal fractures, dislocations, even standard intervertebral disc disease. But these usually come with neck pain, which again is typically absent here,
Yeah.
and IVDD is less common in young, large dogs anyway.
Okay. And just to cover all bases, routine blood work.
Usually normal. Your standard CBC, biochemistry panel, urinalysis, they typically don't show anything specific to this condition.
So the MRI shows us where the damage is, but if you were to look at the tissue itself, say under a microscope after necropsy, what's actually happened to the nerves?
Good question. Pathologically, you see the damage is worst in the white matter of the cervical spinal cord, but like the MRI suggests, it actually extends all through the spinal cord and up into the brainstem.
And what does it look like to the naked eye?
Macroscopically, you'd see these distinct whitish, sort of opaque areas. That's where the myelin, the insulation has been lost. They show up really clearly in the dorsal part of the lateral funiculi in the neck and also in the pyramidal tracts in the medulla oblongata part of the brainstem. And it's symmetrical on both sides.
Symmetrical again. And zooming in microscopically, what's going on with the nerve fibers and that myelin insulation?
Microscopically, you see the damage is concentrated in those white matter tracts we mentioned, the dorsal spinocerebellar, lateral corticospinal, reticulospinal, cerebrospinal tracts, and the cervical cord.
Okay.
And in the brain, it hits the pyramidal tracts, crus cerebri, medial lemniscus, parts of the cerebellum connections, trigeminal nerve tracts, even the optic tracts. You can also find little spots of damage in the folds of the cerebellum itself.
So are the actual nerve fibers the axons dying off, or is it mainly the insulation?
That's a key point. The loss of the myelin sheath, the demyelination, is actually more extensive than the loss of the axons themselves.
Really?
Yeah. You see a lot of reaction from the support cells, the astrocytes, something called astrogliosis and astrocytosis. But quite surprisingly, even in areas where the myelin is heavily damaged, you can often still find axons that look relatively normal structurally.
Wow. So the wires are okay, but the insulation is gone.
In many places, yes. That's a simplified way to think about it. And again, while it's typically bilateral, there can be some slight asymmetry in the damage microscopically too.
That detailed pathology really helps understand what's physically happening. Okay, let's shift to managing this. If a dog is diagnosed, what can be done? Is there a cure? A treatment?
Unfortunately, no. The sources we looked at don't mention any specific drugs or therapies that can stop or reverse this disease.
So management is purely supportive.
Pretty much. It's focused on keeping the dog comfortable and maintaining the best possible quality of life for as long as possible. Usually this can be done at home on an outpatient basis, unless the dog gets to a point where they need intensive nursing.
And what does that supportive care look like day to day for an owner?
It means letting the dog do whatever activity they can comfortably tolerate. Not pushing them, but not overly restricting them either. Making sure they get enough food is really important.
Right.
Sometimes, as the condition progresses, they might have trouble bending down to eat, so owners might need to raise food bowls or find other ways to help.
And owners need to understand the progression.
Absolutely. It's vital. They know this is progressive, and sadly, the dog will eventually lose the ability to walk or even stand on their own.
That's incredibly tough. How is the progression monitored?
Regular vet checks are key. Monthly neurological exams are usually recommended to track how things are changing.
And other practical care aspects.
Preventative care becomes really crucial, especially as they become less mobile. Things like preventing bed sores by providing soft, clean, dry bedding, and managing incontinence to avoid skin irritation from urine or feces. Good nursing care is paramount.
What's the usual time frame? How quickly does it tend to get severe?
The information suggests that severe weakness in all four limbs, tetraparesis, typically develops within about 6 to 12 months after those first clinical signs appear.
6 to 12 months. It's not very long.
No, it's often quite rapid progression, unfortunately.
Yeah.
And given the severe decline in mobility and overall quality of life, euthanasia is, sadly, often the kindest outcome that owners eventually have to consider.
Right. A very difficult decision.
Very.
Okay, so let's try and summarize what we've covered in this deep dive. We've learned that Rottweiler Leukoencephalomyelopathy is a serious progressive neurological disease.
Yeah.
It has quite specific clinical signs, especially that ataxia.
Mhm. And very distinctive MRI findings, those bilateral symmetrical bright spots in the cervical cord and brain white matter, plus the specific pathological changes, mainly that extensive demyelination.
We've also really highlighted the strong suspicion of a genetic cause, likely autosomal recessive, and the fact that diagnosing it early can be tough because it starts subtly and can mimic other conditions.
Absolutely. The insidious onset and the need for MRI really underscore the diagnostic challenge.
Which brings us to a final thought for you, the listener, to perhaps mull over. Given that this condition likely has a genetic basis and the devastating impact it has on these dogs and their families, what role does responsible breeding play?
Yeah, how can informed breeding practices potentially help reduce the frequency of heartbreaking inherited disorders like this one within specific breeds? Something definitely worth thinking about.